Ever wondered how a single medication could make such a difference in managing heart failure? Meet Entresto, a game changer combining sacubitril and valsartan to tackle heart failure head-on. If you're navigating heart health or curious about the latest treatments, understanding Entresto is key. In this video, we'll explore the top 10 must-know facts about Entresto, from how it works to practical tips for safe use. Entresto is a medication designed to manage heart failure by combining two active ingredients, sacubitril and valsartan. Sacubitril works by inhibiting neprilysin, an enzyme that breaks down beneficial peptides involved in regulating blood vessel dilation and fluid balance. This inhibition helps increase vasodilation and diuresis, which can relieve the strain on the heart. Valsartan, on the other hand, blocks the effects of angiotensin II, a hormone that causes blood vessels to constrict and raises blood pressure. By combining these mechanisms, Entresto helps improve heart function and reduce symptoms associated with heart failure. Number 1. How does Entresto help in managing heart failure? Entresto offers several benefits for individuals with chronic heart failure. Studies have shown that it reduces the risk of death and hospitalization compared to traditional treatments like ACE inhibitors. By enhancing the body's natural mechanisms for fluid balance and blood vessel function, Entresto not only improves symptoms but also enhances overall quality of life. This medication is particularly beneficial for patients with reduced ejection fraction, where the heart's pumping ability is compromised. It's also approved for use in children over 1 year old, making it a versatile option in pediatric cardiology. For patients who struggle with swallowing pills, Entresto is available in a sprinkle form that can be mixed with soft food for easier administration. Number 2. What are the benefits of using Entresto? Entresto stands out for its effectiveness in reducing mortality and hospitalizations in heart failure patients, surpassing traditional treatments like ACE inhibitors. It not only improves symptoms but also enhances overall quality of life by helping the heart function more effectively. Number 3. What are the potential side effects and risks? Like any medication, Entresto comes with potential side effects. Common ones include low blood pressure, increased potassium levels, and occasional dizziness. Some patients may also experience kidney dysfunction, especially those already on diuretics or with pre-existing kidney conditions. It's important to monitor for signs of these side effects and consult with your healthcare provider if any concerns arise. Additionally, Entresto has a black box warning due to the risk of fatal harm, making it crucial for women of childbearing age to use effective contraception while taking this medication. Number 4. How does Entresto compare to ACE inhibitors and ARBs? Entresto has shown superior outcomes compared to ACE inhibitors like enalapril in clinical trials. It significantly reduces the risk of cardiovascular death and hospitalizations in patients with heart failure. This makes it a preferred choice in modern heart failure management, particularly for those who cannot tolerate ACE inhibitors or ARBs. Entresto's unique dual mechanism of action provides broader benefits by targeting multiple pathways involved in heart failure progression. However, it's essential for patients to discuss with their healthcare provider to determine the most suitable treatment option based on individual health needs and consideration. We made a book, 10 questions everyone should ask their pharmacist. You can find a link in the description below. Feel free to check it out. Number 5. How should Entresto be dosed and administered? Entresto dosing typically starts low and is gradually increased over several weeks to minimize potential side effects like hypotension. For adults, the usual starting dose in Entresto is 49/51 mg twice daily, which may be increased to Entresto 97/103 mg twice daily as tolerated. Pediatric dosing is based on weight and requires careful adjustment under medical supervision. The medication is available in oral tablet form and an Entresto sprinkle, which can be opened and sprinkled onto soft food for those who have difficulty swallowing tablets. Number 6. How effective is Entresto in clinical practice? Clinical trials have consistently shown that Entresto is more effective than traditional treatments like enalapril in reducing the risk of cardiovascular events and improving overall survival in heart failure patients. Its ability to enhance quality of life and reduce hospitalizations underscores its importance in modern heart failure management. This effectiveness extends across different patient demographics, including pediatric populations with specific heart conditions. Regular monitoring by healthcare providers ensures that patients receive optimal benefits while managing any potential side effects. Number 7. What medications interact with Entresto? Entresto interacts with several medications, including ACE inhibitors, ARBs, potassium-sparing diuretics, and NSAIDs. Concomitant use of these medications can increase the risk of hyperkalemia, kidney dysfunction, or reduce the effectiveness of Entresto. Patients should inform their healthcare provider about all medications they are taking to avoid potential interactions and ensure safe treatment. Adjustments in dosage or medication schedules may be necessary to minimize risks and optimize therapeutic outcomes. Number 8. What special considerations apply to elderly and pregnant women patients? Special considerations apply to elderly patients, pregnant women, and those with specific medical conditions such as kidney impairment or diabetes. Elderly patients may require careful monitoring due to potential age-related changes in drug metabolism and sensitivity. Pregnant women must avoid Entresto due to the risk of fatal harm, and effective contraception should be used during treatment. Patients with kidney impairment may need dosage adjustments, and close monitoring of potassium levels is essential to prevent complications. Number 9. What tips can help patients manage their treatment with Entresto? Patients can optimize their treatment with Entresto by following a few practical tips. It's crucial to take the medication as prescribed, usually twice daily, and to report any unusual symptoms or side effects to their healthcare provider promptly. Monitoring blood pressure regularly at home can help detect any changes early. Avoiding salt substitutes containing potassium and discussing any new medications or supplements with their doctor are also important steps to prevent interactions. Lifestyle changes such as maintaining a healthy diet, staying active, and quitting smoking can further support heart health alongside Entresto therapy. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life!